Well, new visiting restrictions go into effect at Novant and Atrium as respiratory viruses spread. So starting Tuesday, children under the age of 12 are asked not to visit Atrium Health facilities, and children under the age of 13 are asked not to visit Novant Health hospitals in North Carolina unless they're getting treatment. So this is an effort to be able to take extra precautions to reduce the spread of respiratory viruses. And joining us now to talk about this change, Atrium Health internal medicine and infectious disease Dr. Katie Passaretti. And Dr. Passaretti, tell me first, I mean, you see just the worst of these viruses being an infectious disease, doctor. So for this change to happen, what are you seeing that you can let us know as to what's going on behind the scenes?
Yeah, so both within our hospitals in this area as well as in our communities, we're seeing pretty steep increases in specifically flu and RSV. Those patients, maybe some of them end up in the hospital, and that's adding to already high patients in the hospital setting in our emergency departments. So, you know, it certainly is hitting our communities and causing significant impact.
So at Atrium Health, are the temporary visitor restrictions in all areas of the hospitals? And how long do you think these restrictions will actually be in place?
Yeah, so our goal with these additional measures are really to protect our patients when they're at their most susceptible. So in our acute care hospitals where patients are admitted, they have lots of healthcare worker contact, they're sicker and at higher risk if they do get a virus. In our congregate settings, so areas where a lot of patients and a lot of teammates and sometimes visitors all mix and mingle, so skilled nursing facilities, rehab centers, and then in our clinic areas, specifically the ones that are highest risk, so have our bone marrow transplant patients and whatnot. So not every area in the Atrium footprint has these restrictions. It's really those targeted high risk areas of acute care hospitals and ED settings, congregate settings like skilled nursing facilities, and then those very specific hem-onc bone marrow transplant clinics.
All right, and have you received any pushback with this now new policy that's going to start tomorrow? And are you making exceptions for any special cases?
Yeah, of course. You know, there may always be a need for someone to visit a loved one in the hospital, and absolutely there is a pathway for exceptions for those individuals in discussion with the clinical team. You know, this visitor restrictions are something that Atrium Health has done in conjunction with Novant Health, other healthcare systems in the area for many years, even preceding the COVID pandemic. So, you know, TBD how much pushback or whatnot, but right now we're kind of doing it per normal course, even pre-pandemic.
All right. It's rare to be able to get this straight from an infectious disease doctor, so I really appreciate your time, Dr. Passaretti from Atrium Health. Thank you so much.